ER physician came in, having only seen the CT scan, expected me to look terrible. I don't show a lot of sign that something was wrong. I looked very much like this. And so that kind of put her mind at ease, like, oh, this isn't a crazy emergency, and handed it off to the surgeon, who then came in. And I never saw that ER doc again. Like, it was that one, you're not dying on me? Then we're okay. Which was kind of weird, but tough to sit in an ER for hours just waiting and not knowing why I'm waiting. Like, what am I waiting for? What am I waiting on? I knew that there was something wrong, and I had enough people talk to me saying, well, it's probably not a ruptured appendix and we don't know what it is, that I started using the big C word and saying, well, could it be cancer first? I feel like I prepared myself for that bad news before anyone else wanted to say anything. I prefer to know what the doc's thinking. Like, well, hopefully it's just a ruptured appendix, but there are other things it could be. Mainly, there's a possibility it could be cancer, but let's rule that out. Since I had already used the words cancer and I was prepared for bad news, when they came in and told me that that's what it was more of a relief. Like, we have an answer to what the weird CT scan showed, and now we know that it's cancer. Let's talk about how we're going to do this. Like, what are we going to do to treat it? After the surgery, I was admitted up to the surgical floor. One of the great things that the surgeon anesthesiologist did discuss is that I got an epidural, which I thought that was mainly just for C-sections and giving birth. But the epidural was good and bad. First off, I used almost no narcotic pain medications. Even when that was discontinued and I went home, I took maybe a couple of pills. So having the epidural instead of just narcotic pain medication was awesome. The downside was the placement was not ideal, in that one side of my nurse was getting bathed while the other side wasn't. So the amount of medication that they were sending through the epidural was higher, which made my left leg almost completely numb and just took away the pain on my right side, but I could feel everything. So it was a very weird sensation. Regardless, it did do the job of, I didn't need any more pain medication, which was a great thing. Other great things on the floor, the nursing staff was exceptional. There's a couple that really stood out, and I'm a pretty smart guy, but I don't know everything. And the thing I do know how to do is find answers, know where to look to find the answers. But the nurses know way more than I did. And there was 2 nurses who really took the time to educate me and give me resources and talk me through what they've seen in the past, which really helped me understand where the path that I was going to be taking. So, my surgeon was also amazing. His bedside manner was great. He would come in and talk with me. He'd joke with me. It wasn't just in and out, and it wasn't all business and talking about cancer. It was lighthearted and joking, and was nice to have someone come in who wasn't just, oh my goodness, how are you doing? This must be so rough for you. But just like, hey, how's it going today? Just a different attitude was nice. The things that weren't as great within the hospital, one was answering call lights. I don't want to annoy the nurses, and I don't want to be a burden to anybody. I'm a pretty capable person, but I need help going to the bathroom. With the abdominal surgery, I couldn't like do a crunch to sit up to the side of the bed by myself. Once I was up, I could walk, I could get around, but I needed help transitioning to the side of the bed. And so I needed to call for help. And it would, with the surgery as well, came a lot of GI upset. And it was sometimes tough to wait as long as I did at times to get help just to go to the bathroom. Another part I think that the surgeons did really well with was going out to where my wife was waiting in the waiting room and talking to her and reassuring her that everything had gone well. And someone was sent out in the middle of surgery to give her an update, said things are going well, even when it took hours longer than it was supposed to, because she knew how long it was supposed to take. So the fact that someone came out and said, hey, we're still doing okay, it's just going to be a little bit longer, it was reassuring to her. So having that kind of interaction with my wife, it's like, I was a patient, but she's also going through quite a bit at the same time. So that's huge, bringing family into the picture. Doing bedside report is a great way to, involve the patient in everything that's going on, and introduce the next shift. So each of my nurses and CNAs did a great job at the beginning of each shift introducing themselves and letting me know who they were. The people that I never really got their names or didn't know exactly who they were, what they were doing, were those people just came to answer a call light or just came in intermittently. I always knew who my nurse was. I always knew who my CNAs were. And I knew the role of the other people who came in by the scrubs they wore. But I have no idea what their names were. Throughout my stay, there were several nurses that really just kind of seemed to stand out in that they didn't seem rushed to get to the next patient. Though I'm sure that they maybe felt that way at times, that didn't get portrayed to me. It wasn't just, how can I help you right now, and then get out of the room. And some of the CNAs, the exact same way. And my surgeon definitely took time while he was in the room, and I don't feel like he was rushed to get off to his next surgery or to round on his next patient. But that's not the case with everybody. And I think the biggest thing about the staff is just, when you're in the room, be present in the room, which it's hard to do when we all have a million things running through our mind, but it makes a big difference in whether you feel cared for. It's nice to have people like introduce themselves as well. And with the surgeon, kind of an entourage would come in. I knew the surgeon and I had met him, and we had talked several times before and after surgery. But his nurses that he rounded with, the PAs, they were just extra faces in a room that weren't introduced. I didn't know their names, and really what their role was, other than the fact that I could read on the name badge that one was a PA and one was a nurse, and I don't know why they were there. I think my biggest takeaway to improve on is education. Care can be great and everything else, but if the patient isn't ready to leave the hospital knowing everything they need to know, then have we done our jobs well? Is that patient going to come back for something that could have been prevented with education? This experience is going to change the way I nurse in the future, because I can now relate more to being a patient. What it's like to lay in the bed and be looking up at everybody who comes in. Knowing what it means to be present in the room and not rush to get out and get to the next task. And just being able to sympathize more than empathize with patients, because we all got into healthcare, we can all empathize with our patients, but to be able to actually have a similar experience and understand that a little more is going to change just how much I care, like the way we care for our patients, the way I care for my patients.